Welcome back to AZAM.
In just over 7 hours, a new stay-at-home order will go into effect for Arizona, limiting interaction throughout the state to essential activities and businesses only. And the man who made that order joins us live now, Governor Doug Ducey. So, Governor, I'm going to start by saying what I said to you last time you were on there last week, and that's thank you for all the long hours you and your team are putting through to guide us through this crisis. And thank you for the time talking with our viewers this morning. Okay, so you're stay at home, stay healthy, stay connected. The three different parts to this. The order goes into effect at 5 o'clock today. A lot of people applauding it, but I'm also hearing from a lot of people saying it's not a huge change from where we are right now. So for those people, what are the biggest changes between now and 5 o'clock that they're going to see?
Well, it is a big change. I mean, this is increased guidance in alignment with the CDC, the Centers for Disease Control. There is a stay-at-home directive from the governor's office. Now, we wanted this to be holistic, so we added stay healthy and stay connected because we think that that, of course, is going to be important for our citizens. But you've probably noticed on the way to work today, Troy, the state has basically shut down, and it's even more so today. This idea of physically distancing, of being 6 feet away from others, is even more important and critical as we slow and stop this spread. So that's why the guidance came with the increased recommendation from Dr. Kara Christ, and we're going to be this way through at least April 30th.
So if you look through the list of essential businesses and activities, you can see where most of them, the vast majority, you can keep your social distancing. One of them, though, that seems like it'd be very difficult, and it keeps being brought up again and again, even Phoenix Mayor Kate Gallego said, I don't know what message it sends when manicures are essential, are salons. So somebody having to touch somebody else to do nails or to cut hair, how is it safe to go into a salon and be that close to somebody else?
Again, I'm making these decisions with the guidance of subject matter experts, and the thing I want people to focus on is not so much the business side of this, but their personal responsibility and how they can help slow and flatten this curve. That's the idea of staying home, of doing essential things. If you need to go to the grocery store, only buy a week's worth of groceries for a week's worth of needs. We're all in this together. This isn't about shutting down businesses, although most businesses are shut down. Most non-essential employees have been sent home, and if they can work from home, they're working from home. I've been in some of the studios this morning. Nobody's there except the anchors. So most businesses are conducting themselves this way. The order was put out in that fashion, and as long as people follow it, we're gonna get through this.
I hate to press you on this, Governor, and respectfully, you're not able to do that when you're cutting somebody's hair. You know what I'm saying? You're very close. So we can be apart, and we're apart here in the studio, but that's not the same with the salons.
Like I said, I wrote this order in guidance with subject matter experts. I'm confident we're making good decisions, and people can make their own judgment call as to what they want to participate in. But they're going to have to follow the order.
Let's talk about where we are health-wise right now. I know we're working on reopening St. Luke's. Are you confident right now that we're going to have the number of hospital beds we need when we are at the peak of our curve?
This is my top priority. It's my team's top priority. It's Dr. Kara Christ's top priority. And I am confident we are going to be prepared. We're not getting hit like New York State right now. We've had time to prepare and to plan and to prioritize. So we're accumulating supplies that we're going to need. That's the gloves, the gowns, the masks, the hospital beds, the ventilators. We're constructing field hospitals. There'll likely be 2 in Maricopa, 1 in Pima County. We've got a special field hospital on the Navajo Nation now. We're going to likely see, this is what the doctors tell me, the peak in terms of our people that contract COVID-19 and come down with the sickness in April, and our hospitalizations in May, and we're going to be ready.
So obviously keeping people as healthy as possible and keeping people alive, the top priority. But as we look out, there are some pretty grim economic forecasts out there, and you have been the jobs governor. I've seen predictions that we could see massive unemployment here in like a month and a half, 2 months. How confident are you that once we get through this for the most part, that Arizona is prepared to come back?
Oh, we're going to get through this. We're going to get through it together, and we're going to come back faster and stronger than any other state. That's the position that we were in. What I want to make sure in the meantime is we're prioritizing public health as the top issue. Beyond that, we're going to make certain that no one falls through the social safety net. We're going to stretch it. We're going to strengthen it. There's a $2 trillion package from the federal government. That combined with Arizona's fiscal health, $1 billion in our rainy day fund, we're going to be able to make certain that people navigate through this, and we want to get through it. Let's stay together as we go through it.
So you're confident that people who are losing their jobs right now, can you imagine how many servers at restaurants are losing their jobs and small businesses who are worried about it? At least in the short term, you're confident that we have the resources in place, both federally and here at the state, that people will make it through this financially?
Oh, I'm confident that people are going to make it through this. Who I'm most concerned about are people that live paycheck to paycheck and our small business owners. One of the toughest decisions I had to make was to shut down restaurants, but it was the right thing to do. Our restaurants are available for takeout. Please patronize your local restaurants, your favorite restaurants, and be as generous as you can in tipping the service workers that are still employed and so essential to what we're doing. But we're going to get through this, and like I said, we're going to have resources for that social safety net, but we want to make sure that the people that need it most are being taken care of. No one's going to be evicted from their apartment. People aren't going to lose their homes during this period. People aren't going to have their businesses locked down or shut down. We just need them to follow the directives, follow the rules, and enforce social distancing to the best of their ability.
One last question, Governor. Do you see this as being the last step you're going to take, or is there another more restrictive order that could be on the horizon if something suddenly turns for the worse?
There's a lot of tools in the toolbox when you have an emergency declaration. I'm not looking to escalate just to escalate because I have the authority under law. I want to make the best, most responsible decision for Arizona's situation at the right time, and I'm confident to date we've been able to do that.
Governor Ducey, again, thank you to you and your team for all your hard work, and I'm sure we'll be in contact here over the coming days and weeks. Thank you again for being on here.
Thank you, Troy.
We'll be right back.